Okay, I got you. Yeah, that definitely could be really frustrating, especially after the students did a lot of work. Now, I know the area specifically, I know you had mentioned in your email to us back in July reference to tier one and tier two scoring. Now, one of the things that's kind of changed in the pharmacology module, tier one and tier two scoring is not directly correlated with the final grade that the student receives. That's actually directly on the first and second strike questions. And I'll be able to walk that through with you today. But kind of what made you want to come back and take a look at the pharmacology piece? Mm-hmm. Absolutely, yeah, and that's definitely something that if you all did want to try to use the pharmacology piece again, that would definitely be something. So there were a couple of different key changes that I'll definitely highlight today. Obviously, you have a vast amount of the information already, but kind of the overview, because I'm actually new to the Oregon territory. How many students do you guys typically get in your pharmacology course, and how do you traditionally teach that? Time of year, methodology, things like that. Okay, so typically you get it in the winter and the spring terms. Absolutely. So kind of looking in terms of, before I get started too much into dive in, what are you hoping that virtual simulation can do for your program? Okay. Okay. Yeah, absolutely. And you speak a lot to, I mean, you are, like I said, you are familiar with some of the things that were in the pharmacology assignment. Safe medication admin practices, definitely is a huge thing, as well as the classification, the application piece. So like I said, I definitely will go through and highlight some of the things that have been changed or enhanced. And we can definitely walk through that as well. And if you do have any questions, like I said, I know you aren't able to access the phone today. But if you have any questions, feel free to type that in there and I'll stop wherever we go along the way. Like I said, since you are familiar with it, I will kind of skip through some of it. Normally, I like to give people a little background, a little context on what shadow health is, but really, I'm going to dive in on a couple of the different things that we have, and I'm going to load this concept lab up real quick. Let me see here. Oops, that sent me back to the main page here. All right, let me go ahead and load this up. Now, again, some of this is going to probably be review content view, but really the highlighted focus, again, is going to be on some things that have changed in terms of the grading. Let me take a peek here. So obviously you're familiar with the making these steps in the nursing process here. So obviously as we go through here, this is going to be John Larson's assignment, as you probably remember. Before the students begin the assignment, they're going to be prompted to create a mental model, which is going to have them go through the different steps in the nursing process in that appropriate order. Now, this is actually going to give, this interaction is going to give a structure that's going to allow for the organization of different safety checks, and the student's going to be able to drag and drop each additional step. So once they get these 7 steps in the right order, they're able to go through and proceed with the initial step, which is going to be the assessing the orders and getting the patient documentation, and really going to be double checking those for both the safety as well as the advocacy of it. All right. So for the sake of time, I will go through this here. Let me go ahead and put through here. Whoops. I'll show why it's not on you. All right. All right, awesome. So this brings up here. All right, awesome. So then as we get onto this list, I just want to give you an opportunity to just kind of orient you to the screen you see here. You can see on here, we have a couple of different things we'll be kind of able to go through. If this is all review, just let me know. But they're going to have the opportunity to check up on the medication and see if there's going to be any contraindications in here. Now, is this all looking familiar to you thus far? Mm-hmm. And what do they like about this particular area? Mm-hmm. Yeah, absolutely. And I'm glad to hear that. So obviously, as the student goes through here, a lot of different opportunities are going to have to check the route and the dose. But since this is review, like I said, what I'll do is I'm going to go ahead and pass through this.
Now you are ready to assess the patient.
And we'll go into the main module here. You can start off with the statement. Mm-hmm. Yeah, and that's something, these 3 patients are obviously going to be guided patients. So what's nice about that is they have preceptor Diana every step of the way. So as they get into this assignment, we can go through, and we obviously we went ahead and greeted ourselves. So we can enter the room, so we can go and ask a question. We can say, how are you feeling today?
I've been better than cooped up in a hospital bed, that's for sure. Other than that, I guess I'm okay. I just want to put this surgery behind me and get back to work.
Okay. We can follow that up with, are you in any pain?
I'm not in any pain right now. My knee was really hurting a few hours ago, probably because of the surgery. You don't get through a total knee replacement without some pain, huh? The last nurse gave me some pretty heavy stuff for it, though. So, no, I'm not in pain.
Okay. All right. So hang on. I'm reading your message you sent. So, okay. So these are a couple of the areas. So what we can do then is normally I have a sample pulled off on the back end, but what I'm going to do today is I'm actually going to click through this assignment and we can see what it grades on this assignment. Some of the things you are mentioning have been worked on and extensively improved, like being able to recognize those points. So what we'll do is we'll kind of go through this particular example, and when we can check on the back end, how they're being scored, what are they being scored on, and then we can actually compare that to what I did in my assessment. I think that could be a good opportunity to kind of see some things. So I'll kind of go through the assignment here. We can go through, so as I'm moving through, I can go on the MAR, and I can see he said he was given some pretty heavy stuff. We can go ahead and see. Okay, he was given some oxycodone, so that's some pretty heavy stuff. He was right. And now one thing I mentioned you probably know is we have a Davis drug guide that's been integrated into here. The student, all the relevant drugs that they're going to come in contact with are going to be presented in here. So really nice thing about that too is if you, I don't know what drug guide you guys use, but this students actually will get 50% off of this particular one as well as free shipping. Always good to save a little bit of money. So if that's something that you guys utilize, the Davis drug but didn't get that in the past, definitely let me know. And then, so in this particular one, we're going to look up oxycodone. So we'll click on this. We can see, okay, there's a high alert medication on here. So this medication is actually going to bear a heightened risk to cause significant patient harm when it's being used in there. So obviously, this gives us an opportunity to go through the adverse reactions. So the confusion, sedation, dizziness, euphoria, floating feelings, hallucination. So we have a really nice opportunity to look up some adverse reactions and side effects on him, and we can really question him on see if he has having any, if he's having any sensitivity or he's having an adverse reaction to drugs. So we can ask him, are you feeling tired?
I'm wide awake.
Okay. How is your breathing?
I can breathe just fine.
Okay. And I can ask him, do you know where you are right now?
I'm in a Shadow General Hospital bed last I checked.
So you can tell he's a little bit snarky, which the students are definitely going to encounter in the real world. But now our job is not only to assess him, but also how he's tolerating the meds he's taken. So we can go to the MAR here. We can see what medications he's going to be due. Scroll to the top here. And he's going to be, okay, so 2 regular medications here are due. So what's nice to do here as well is, as we check the patient's vital signs, we can go over here. Okay. We can check here. Fantastic. So then we can go back, leave the room, continue. Now, this is why it was important to take this. Now, I know this because I've gone through this simulation a number of times, and you would know this because you're an experienced nurse. But a new student may not have thought to take the vitals, or maybe they just forgot with everything else. But what is really important here is this question really speaks to the value of taking the vitals when we did. So which value is most important to assess and monitor when administering lisinopril? So if you really wanted to go through here, you could go and go to listen. You could look at the action. All right. So we can see here it's an ACE inhibitor, lowering so it's a blood pressure medication. So we want to go ahead and click on that. Great, we were right. So it's an ACE inhibitor and contributes to lowering blood pressure. And so that's important. Why it's important to have that baseline value for evaluation. And so that's going to avoid lowering the patient's blood pressure to an unsafe level. Now, does this all look familiar so far? Do you have any questions on anything you're seeing? Okay, wonderful. Awesome. So we can go obviously to the back end here. Now, for the sake of time, what I am going to do is I'm going to skip to the back end because really the majority of the things that were fixed, there was some front end things fixed, but let me go ahead and go to the back. So obviously you and your students have gone through. Let's go here. We'll go skip to the end here. All right, so then there's review questions. You probably know this, but all these review questions are completely customizable. You guys can decide how to do that. So obviously, I'm just going to click on some of these. Not bearing in mind that I'm not going for right or wrong here. What I'm going to try to do is get to the back end and show you how that's graded and kind of break down, because I think that's going to be what the most valuable thing is. And really, we can talk a little bit about this. But besides the grading component, was there anything else the students really complained, or is that the primary reason you guys had kind of elected to move in a different direction? Okay. Yeah, that could definitely see how that could be a problem. So to give you kind of an idea, so it's all good. I understand. It's a Monday. It's early. So I over where you are anyway. I completely get it. So yeah. So I'll kind of give you a background. So we actually have, so we've actually launched multiple undergraduate products now. We came out with mental health and gerontology since the last time actually we've been working with you guys. So basically what happens now is, so the health assessment is $99 and your school is actually already utilizing that. The second product the school purchases is actually $89 a student. And that actually is good throughout the duration of the program, whether you had pharmacology broken up into 2 core sections, whether you taught it throughout the program. There's a lot of different ways it's taught in the nursing community. And the nice thing is, because it is a one-time fee, you can access it that one time, and you get, and you're paid for it at one time, and you can access it the entire time you're at that program. So some really nice benefits of that. But yeah, I definitely can understand how that would be not just, you know, confusing, but also frustrating. So yeah, it would be, for you all, it would be $89 a student. So it's obvious if there's any question on that, feel free to type that in. I will walk you through kind of the overview. So the overall didn't change that much, too much, I should say. Activity results is going to be the one thing that we're seeing a big change in. This is actually has been renamed and been a little reformatted in here. So this is really primarily what the student is going to be scored on. So this is what they're going to be coming in, and really where the 7% came from. So you can see I scored 7% because I only got 7 of these 14 questions right. This is everything that contributes to that overall scoring. The rest of it kind of is an opportunity for them to work on that, not only just to say medication administration, but also the education component of it as well, the education, the empathy, and that's really a nice opportunity for them to go, as they go through here. You know, not only do they need to know what they're talking about, but they sure as heck need to make sure that the patient understands what they're trying to do as well. So you can see here on the list, you can see obviously they're going to have the different, like I mentioned, the drug classifications, and not only that, but the applications of the drugs, and then being able to educate the patient and then implementing those safe medication administration practices. Now this is the area that caused a lot of heartache and grief. So you can see here, I didn't ask about any of the second level things, and that you can see that's here. If we were to go back through, which we can definitely do to administrate, I can have this pulled up and go through and basically have a cheat sheet to see the score if that's something you would want to see. But this back end grading has been improved, but this is actually an additional component. It doesn't contribute to the activity results. That's another big difference as well. So this is going to be what they're scored on. These are opportunities for them as they go through the patient interaction for you to measure how they're doing in terms of that part of it. Does that make any sense? I hope I'm explaining it well. Okay, so the cost and difficulty in the free typing errors are not recognized, as well as the technology recognized by the software, as the terminology recognized by the software. Were there a couple of examples of maybe terminology that were being used that the computer wasn't picking up? All right, so here we are. Yes, you're explaining it very well. I like the changes in this form. Okay. They'd have to be asked about the pain levels from 0 to 10. So I'm reloading the patient case now, because what I'm going to do is the exact same thing earlier. I think walking it through in this methodology is going to be able to highlight some of the differences. Because that sounds like an unfamiliar issue. Now, one thing I might think it could be,
Welcome to your great job.
Let me fast forward. Oh, let's give me a hard time now. Let me reload that real quick. One of the things, okay, so they would follow up on the side effects, but it would not be recognized by the terms. Okay. They would follow up on the side effects, but it would not be recognized by the drugs terms. Okay. It would also follow up on side effects, but we're not recognizing. All right, perfect. So what I'm going to do is, as I'm loading this up here, let me.
Great job.
All right, let me go ahead and get in the patient's room here. So one thing I see your blood pressure's down. Are you feeling? Here's example. Okay. Okay. Yeah. So that's a great sample question. I can ask him as well. One thing I think that maybe could have been happening. Again, I am new to this. No, I completely understand. So one thing that may have happened. So I'll say it. Hey, John.
Oh, hey.
One thing that could have been happening is the student could be pressing in this question here. You see on the statement side, they could have asked the question in there. And this is the differentiation the computer algorithm uses to recognize the students asking a question. Again, I don't have any, I wasn't in this particular area this time last year, but knowing kind of the history of it and maybe some struggles that people have had, this has been an area that people will accidentally put things in and look on the back end. And it just comes down to typing your questions here and the question. I'm not sure. And the other thing I can think of, the only way I could think of that they would sense is if they put it in the question, it would have probably would have known about it earlier. But like I said, I'm going to walk through a similar scenario to what your students did and see if we can get different results. I think we can kind of speak to maybe some of the back end changes. So if we were to ask him, we could ask him, how are you feeling? We'll ask him some of the questions.
I've been better than cooped up in a hospital bed, that's for sure. Other than that, I guess I'm okay. I just want to put this surgery behind me and get back to work.
Okay. Let's see here. So the question was, you asked, blood pressure is down. Are you feeling tired? All right. So that's a good question. All right. We could even just ask him, are you feeling tired?
I'm wide awake.
All right. So we can, I'll actually go to the cheat sheet. I'll kind of cheat a little bit here and actually look at some things. So ask for patient identification. We could actually look at some of the tier 2 findings. So I could look, check vitals after giving medication. I can do the patient assessment to ask about medication allergies. So let's go ahead and ask him if he's feeling nauseous at all. Are you feeling nauseous? Whoops. Let's see here. I see. It would also help to spell nauseous right as well. So this, I heard a bing here. So this is where some of the problems were. They would ask about pain and he would respond, no, I'm not hungry. So they would ask about pain and he would respond, no, I'm not hungry. Okay. So it sounds like maybe some of the matching problems have been resolved. We have done a very big expansion in terms of the back end of like the question bank that John is able to answer. So that kind of helps a little bit in terms of some of those issues, because that's kind of what it sounds like with some of the problems that they were having. So let me ask that again. I can ask him, are you feeling, whoops, are you feeling, what the heck? Oops, I'm sorry, my computer clocked out here. Apparently my computer has also decided that it is a Monday too. All right, here we are. I should. So, all right, here we go. Oh, and then send it back to the beginning here. Exactly right. They're kind of a necessary evil for me. All right. How are you feeling? All right, come on, computer now. All right. All right.
No, I haven't felt nauseous.
All right. So obviously you can see my computer struggles aside here. It was able to answer that question. So on the back end, I'm going to ask a couple more here going off the cheat sheet. And really again, kind of ask about ask about management of prescribed medications. I can ask him, do you take any medications?
I haven't got my regular ones yet, no. The Lipitor and the Lisinopril.
Okay. And I could ask him, and again, I'm going to be very specific here. I can ask him, how often do you take those medications?
I don't know how often they come give it to me. It always seems right on time.
Yes, so that is actually, so one option that you can always do as well. The checklist is something that is more useful. Now, obviously, like I mentioned, it is a cheat sheet. This checklist up here is the results. What you can always do as well, so you can see here, as you go through, one option you can always utilize is reopen. I'm not sure, again, I'm not sure, this is more on our integration team side of things. But one of the things that we do is, or you have the option of doing, is allowing them to go through the assignment once, click submit, they can look at what they need to work on, and then go back and apply that. Again, always depends on what your use case and what you're hoping to get out of it. But that is an option to kind of work around some of those frustrations that you were having here. So now what I'm going to do is I'm going to leave the room. And again, I'm going to answer the patient's blood pressure, great. And what I'm going to do is I'm going to skip to the end here.
Medication.
And again, this is going to kind of give you a nice opportunity to see things. And then as well, you mentioned the word choice. The nice is it does have a spell check built in there. If you can even be remotely close to what you're trying to say, and you will be able to get to the right place. That's a really nice opportunity for them. But before I get to the grade book, any questions so far? Concerns?
Now we can return to the patient's.
Yes, so that's a great question. And I'm actually going to have to double check on this. So there actually is some sort of checklist available in our other simulations. Pharmacology is kind of an interesting one because of the drug terminology. I believe that is something that is going to be coming soon. That there's going to be a checklist that will kind of help provide some of those and help bridge some of that subjective data. I'm not sure, because pharmacology, like I said, it is a different animal, so I'm not sure it's the timeline of that. But there is going to be here in the near future. But that's a good question. And that's something I can actually find out a little bit more following the meeting today and actually get back to you right on that. Okay, perfect. That sounds like a plan. All right, so what I'll do is I'll jump back through here. Now, had you been looking using this potentially for the winter semester? If you were going to try it again? The content's only enough for one term. Okay. Now, what do you teach in the second term? That wouldn't be covered in here. Okay. Chronic disease. Okay. Yeah. Is that something we've definitely looked at developing something for patho, and we're just trying to we're trying to get our ducks in a row in terms of that as well. But I could see the value in that as well. All right, awesome. So let me go here. So you can see here on the right-hand side, I only asked about the patient identification, but you can see the two things I asked about in the tier 2 that we had questions about. It was able to cross those out. I know that was something that was pretty frustrating for the students, and maybe it seems like it has been fixed. But did you have any questions on that component of it? Okay, so hang on, I'm reading your last chat here. So medication's done with the pathology of the body. Sorry, back. Okay, yep, yeah, that makes sense. So then this content here would be taught in the spring, from what I understand, correct? Oh, good. I'm glad to hear it's a little clearer. Probably winter. Okay. And when is winter for you? Like, I guess it's kind of a weird question, but when is your winter semester for you guys? January, March. Okay, wonderful. You're on quarters. Awesome. Yeah, so definitely what we can do. Now, was there anything? I know this kind of highlights the things that you had want to see. One of the other things, let me pull up real quick. Did you have your students working on Ed Carter when they were in there? And I'll pull him up real quick so you can kind of, he was one of our ungathered patient cases. Let me pull him up. I don't know if you remember that detail or not.
Hello, my name is.
Because if you don't remember him, what I'll do is I'll walk through him real quick, and you can kind of get an idea of a couple of the different things that you can do within here. I think we use it as a capstone project for the term, I think. Okay, wonderful. So you are familiar. There are a couple of changes in here. I'll actually be able to run through those with you as well. So I'll run through those real quick. But did you have any questions on anything you're seeing so far?
Welcome to the unguided intermediate.
Awesome. I'm glad to hear that. All right, so I'm going to pull this up here. So actually, I mentioned that you had mentioned that there was a checklist in pharmacology. So there actually is one patient. The other three patients, we are considered guided patients. There's actually a nurse preceptor that helps guide them along, and that actually takes the place of the checklist within the simulation. You'll see on here, however, there is a checklist. So this is actually going to be our energy guide. So I'll actually be able to demonstrate a little how this works. So if I can actually greet my patient and say, "Hey Ed, I am your nurse, Matthew."
Hello.
So if I can ask him, if I were to expand this and I wanted to know, I could ask him just the first question: what brings you into the hospital today?
I had this terrible pain in my back, and this morning I think it was blood in my urine. It was a pink color. I could tell something serious was going on.
Okay, wonderful. So what's really nice about this is you could probably see this change from a 0 to 31 to a 1 to 31. If I expand that, you can actually see I actually checked off establishing the chief complaint. So if I were to open the history of present illnesses, I have a check mark about all of these things, and this actually is going to give me a guide as a student to going through these modules and to be able to have kind of a nice roadmap of how and what questions I need to be pointed about asking going through here. Is that something you consider see value in for your class? Okay. What do you think they'd appreciate about this? Oh, 100%. No, I definitely hear that. So this kind of, what's nice about this, as I mentioned, is that this kind of, a lot of the times what we heard when we developed this was people kind of struggled with even like when student nursing students come in, they struggle with like, what questions do I even ask? Like they get in here and they just don't even know what to talk about. So this kind of gives them a nice chance to do that. as they go through the assignments in here. So again, really cool opportunity for them to be able to do. And that, I think it speaks to some of the things that you were kind of saying about having that checklist. So this gives them that. So I can actually, you can see, go through here, I can actually go, let me open up his past messages here. I can ask them, do you have any existing health conditions? Perfect. So this kind of just shows one of the things I actually wanted to highlight here is if I type an exact question in here, this is meant to be a guide. It's not meant to be a copy and paste. So that's one of the things that faculty usually express a little concern about is, oh, you know, I'm not too sure about this because it seems like they're just going to type it in. They're just going to copy and paste it. They can't. They are going to have to actually start to formulate questions on it. This is a guide. It's not going to do the work for them. So do you have any existing health conditions? So the best question to ask in that scenario would have been, do you choose the other option? So do you have any health concerns? Perfect.
Yes, I've got a few. I'm diagnosed with chronic kidney disease, and I have some typical old man stuff, high blood pressure and atrial fib. I noticed a little heartburn here and there too.
Okay.
It's getting to be quite a list.
Yeah, so obviously you have the opportunity here to empathize with Ed, and this is another good chance for them to be able to do just that. And I 100% agree. That's something we are working on. I'm not too sure the timeline for what that's going to look like. But yeah, so this is going to be a nice chance for the student. And you can see that obviously by rewording the question, I have the opportunity, it checked off the second one, and you can see all the way through here. We can do that. So we are going to obviously orient you to the screen here. All of this is probably familiar to you. You have the EHR, you have the MARS, the Davis Drug Guide. All of this is going to still be there. Now, I'm not sure if you knew this when you got it last time, but this is actually developed in use for Houston Institute. So as you're going to see, once the student assignment is graded, they're going to have the Q-think competencies mapped within the back end of that, and really showing them on which areas they're going to be able to improve on. So what's really cool about that is this feedback is the detailed feedback is it's actually in the unscored, but it's a fantastic way for them to be able to illustrate the knowledge and the skills, all that are going to contribute to the quality and safety that nurses can get. Is that something you guys utilize those? Okay. Those are familiar. Glad to hear the Q-think. Okay, wonderful. Now, did you speak to those at all when you used it in the course, the Q-think competencies? Okay. Yeah, that's fairly typical for what I see with a lot of other courses that utilize this. Okay, perfect. So one thing, that kind of concludes the final things I show you. Again, you're kind of a unique case because you've seen this product somewhat recently, but I kind of highlighted a couple of the different differences. Did you have any questions on anything that you saw so far? We're integrating more Q6. Okay, wonderful. Yeah, definitely something. I'm not sure if any of your colleagues would be interested, but we are the mental health and the gerontology products actually were created with the help of Q10. So you could definitely, if that's something you want to, if they ever want to explore a little bit further, we can definitely set up a time to do that. And I can definitely work with them in terms of if that's something they're interested in pursuing. I can even send you a little bit of information to share with them if that's something you want to just have a little more information about. Okay, wonderful. And now, do you teach the course with anyone else? How are typically decisions made at your university? There are 5 of us in the department, and we can all teach them, so we collaborate. Okay, wonderful. Now, so the timeline you had mentioned is going to probably be January to March next year. So definitely have a little bit of time to be able to make the decision. What would it be beneficial, do you think, to try to set up a time for me and the 5 of you all to meet and kind of look over some of the improvements and walk through those? Okay, wonderful. Definitely understand that. And what I can do, kind of the next step for, for in terms of the process is we actually have something that's actually been developed probably since the last time you even integrated the technology. Is we have actually added something we call the research and exploration video. It's actually going to be a 20-minute video that really kind of moves through a couple of really good components. So it actually is divided up into 2 10-minute segments. And the first half is actually going to focus on what qualifies our critical thinking rubric. And then it also talks about key integration ideas. I think that definitely can go a long way in terms of helping the student frustration and as well as your frustration. Because if the students are frustrated, you guys are going to be frustrated. And it really talks through a couple of different integration strategies that can be beneficial. And then Aubrey, I'm not sure you probably remember her. She actually can help you walk through and create a specific plan for that. I'm not sure if that video would be something you'd be interested in learning a little bit more about and kind of taking a look at. Okay, absolutely. So then if you want to wait to hear what the others think, totally understand that. What we can do then is maybe set up a time. When do you think you'll have a chance to chat with them? Probably later this month. Okay. So what we can do is today is the 2nd. So we want to say maybe 2 to 3 weeks out. If you have some time, we can set up a time to just kind of touch base and kind of and see what the faculty said, and if that's something they're interested in doing another demo or doing a demo or what the process. I'm not sure if that is something that would work with your calendar in about 3 weeks or so. All right, wonderful. I will definitely, let me go ahead and pull up my schedule here while I have it up, because if I don't have it on my calendar, I will forget it for sure, even despite my best intention. So let me pull up this here. Is there a day of the week that works well for you? Around April 23rd. Okay. The 23rd specifically, or just sometime that week? That week, only the 23rd. Okay, perfect. Let me take a peek here so I can see what time works. I don't think I have too much on my schedule. Let's see. Yeah, my schedule's fairly wide open. Do you want to plan a time for like 10 o'clock your time? Would that work? or we can do 11 or 12. We can do later that day as well. I actually have open availability after about 10 o'clock. Okay, wonderful. I'm going to send you an email with some literature as well. Like I said, since you've seen it recently and integrated it fairly recently, I'll definitely send you maybe some updated stuff. And then I'll also send you an email about our phone call in a couple weeks from now. And then that way you have my email. And if anything, schedule conflict comes up, feel free to shoot me an email, let me know. But otherwise, we'll plan on the 23rd, about 10 o'clock, your time. And do you have any other questions for me? Yep, no worries. It was a pleasure to talk to you. And do you have any final questions for me? All right, wonderful. Well, I'm going to go send those 2 emails to you. You should get those shortly. Otherwise, I hope you have a wonderful rest of your day and I hope this helps. You too. Have a good one. Bye.